The effects of alcohol and drug use on driving and road accidents. Alcohol and drug use can have a significant impact on a person's ability to drive safely and can greatly increase the risk of a road accident. Alcohol is a central nervous system depressant that impairs judgment, reaction time, and coordination. It also affects the balance and vision. When a person drinks, it takes their brain longer to process visual information, which makes it harder for them to react to changing road conditions. Alcohol also causes drowsiness, which can make a person more likely to fall asleep at the wheel. Drugs, whether illegal or prescription, can also impair a person's ability to drive safely. Many drugs can cause drowsiness, confusion, and hallucinations, which can make it difficult for a person to stay alert and focused on the road. Some drugs can also affect a person's vision, coordination, and reaction time, making it hard for them to control their vehicle. The effects of alcohol and drugs on driving can be especially dangerous when combined. The combination of the two can greatly amplify their individual effects, making it even harder for a person to drive safely. It is important to note that the effects of alcohol and drugs can vary depending on the individual, the type and amount consumed, and the specific drug or alcohol involved. To reduce the risk of a road accident, it is important to never drive under the influence of alcohol or drugs. It is also important to understand the potential side effects of any prescription medications you may be taking and to ask your healthcare provider or pharmacist about their effects on driving before getting behind the wheel. In summary, alcohol and drug use can have a significant impact on a person's ability to drive safely and greatly increase the risk of a road accident. It is important to never drive under the influence of alcohol or drugs, and to be aware of the potential side effects of any prescription medications before driving.